Hey future doctors, welcome to Dentistionary here. You will be provided with information for the doctors from the doctors. Today, we'll be studying about the tooth eruption, how the tooth erupts, and what are the phases and theories given by the scientists about the eruption of the tooth. So let's start. The general introduction, the term eruption derived from the Latin word erumpere, to break out. It means refers to the axial or occlusal movement. Note that it is the axial or occlusal movement of the tooth from its developmental position within the jaw to its functional position in the occlusal plane. In common usage, eruption denotes the appearance of the tooth in the mouth. But before the tooth appears in the oral cavity, they undergo movement along with changes occurring in the jaws. So, under the gingiva, the changes always happens before the birth, from the birth, after the birth. Also, after the teeth appear in the oral cavity and reach the functional plane, they undertake movement as long as they are present in the oral cavity. Introduction. Again, thus all the movement undergone by the developing tooth and by the tooth after being seen in the oral cavity are known as physiological tooth movements. So there can be two types of movements, the physiological or and the histological phases. Okay. For the study, it is divided into the three phases, namely pre-eruptive, eruptive, and the post-eruptive. The movement undertaken in these stages are known as accordingly as the pre-eruptive tooth movements, eruptive tooth movements, and the post-eruptive tooth movements. The pre-eruptive ones are made by a tooth germ within the tissues of the jaw before eruption. As the name suggests, eruptive movements are made by tooth from its original position within the jaw to its functional position in the occlusion. Post-eruptive movements are made by a tooth to maintain it in functional occlusion. Now let's study about stages or the phases of tooth eruption. This is a general representation of how stages undergoes. The A part, okay, tooth crown approaching the oral epithelium in pre-eruptive stage. So this is the gingiva and the tooth is approaching the gingival part. Contact of reduced enamel epithelium including the developmental cuticle fusing with oral epithelium. Fusion of reduced enamel epithelium, including the developmental cuticle and oral epithelium in the C part. In the D part, thinning of the fused epithelia. In the E part, rupture of oral epithelium of the attached gingiva and emergence of the tooth. F part, clinical crown appearance into the oral cavity, the pre-functional stage. You can see the 1/4 or the half part of the crown has been erupted. Now the G part, the whole tooth is in functional occlusion. These are the stages. So the pre-eruptive phase, there are some movements. The deciduous teeth show bodily movement along with the jaw growth. The successive permanent teeth show bodily movement relative to the eruptive movement of the deciduous teeth. So what does that mean? The bodily movement, the successive permanent teeth shows bodily movement, means it emerges from its original position and move towards the occlusion position. The eruptive movement of the deciduous teeth means deciduous teeth are erupting. Permanent molars show tilting movement, maxillary molars from the distal inclination to an upright position, and the mandibular molars from the mesial inclination to the upright position. So, in this, first of all, there is tilting in the movement. The tilted movement or the permanent maxillary and mandibular molars are tilted. Maxillary ones are tilted distally and the mandibular ones are just mesially. Then they comes in the occlusion or upright position. So they can be functional. The histological changes, there is the selective bone resorption and the formation related to the tooth movement. Okay. In the eruptive phases, axial or occlusal rapid eruption after its emergence in the oral cavity to its functional position, pre-functional eruptive movement. So what is that? Axial or occlusal rapid eruption. That is after its emergence in the oral cavity. So what does that mean? Axial it means that axial position, it is the upright position for the tooth to gain the occlusal functionality. It moves towards the oral epithelium, fuses and goes upward, then towards the position pre-functional eruptive movement. Hartwig's epithelial root sheath maps the future roots, root dentine, cementum and bone lining, crypt formation, periodontal ligament fibroblast occurs and they forms and fibronexus with collagen fibers develops. Gubernacular cord guides the permanent teeth in the eruption. It helps in the movement and the direction for the upright position for the functional occlusal. Reduced enamel epithelium causes lysis of the overlying connective tissue, which is above the permanent tooth. Okay, it means this is the tooth and this is the connective tissue and this is the deciduous. So it removes this connective part. Then it unites with oral epithelium as you have seen before. Center part degenerates, tooth appears in the oral cavity, dentogingival junction forms. Post-eruptive phases, axial to maintain its position in the growing jaw. For the growing jaw, as the jaw develops, it can be prognathic or retrognathic, means the mandibular jaw develops further in the forward position. Okay, so the tooth can be tilted, so it maintains its position in the growing jaw to become it upright. Mesoocclusal to compensate for occlusal and proximal wear. Physiological mesial drift. What does that mean? It means that there is mesoocclusal development of the mandible bone or the jaw. So, to compensate it for the occlusal and proximal wear, there is a physiological mesial drift, which causes the tooth to move along the jaw in the direction of an upward and mesial. Histological changes, bone formation and alveolar crest, so it can form the pedial and hold the tooth in position. Selective bone formation distally, resorption mesially, and ladder-like bone formation in the fundus region. So what does that mean? First of all, the jaw is growing forward. So what happens if your tooth is like this? When the jaw develops, it will become like this. So it doesn't happen because the physiological mesial drift, the post-eruptive movements helps it to maintain the upright position. The mesial part readily resorb and form a radle-like bone formation in the fundus region, and then the tooth move majorly and maintain its upright posture. So it appears in the oral cavity like this. Okay, for the functional part. Apical cementum formation, collagen fiber, reorientation. It all happens simultaneously. This is the chronology of the human dentition. It will be very important and you should learn it by heart it for the next years. It will be very important in third and fourth year. Okay, the main thing is when it emerges in the oral cavity. So you should remember these because you will be facing the pedo department, the pedodontics department, and there you will see the mixed dentition. So you will be confused. So you have to study about the anatomy and the emergence of the growth in the oral cavity. Now the theories that how will it happen explained by some scientists. Bone remodeling theory. The bone remodeling theory clearly is important to permit tooth movement, but all the theories are denied. There is no major proofs about that. There are some proofs, some in the favor of the theories and some are against it. Okay, whether the bony remodeling that occurs around the teeth is the cause or the effect of the tooth movement is not known. See, it's contradictory. If the tooth germ is removed experimentally and the dental follicle is left intact, an eruptive pathway forms in the overlying bone. So, what does it mean? Further, if a silicone replica is substituted for the tooth germ, it also erupts. Okay. On the other hand, if dental follicle is removed, no eruptive pathway forms. That's what happens. These experiments established the absolute requirement for a dental follicle to achieve bony remodeling and tooth eruption. For it is the follicle that provides the source for new bone forming cells and conduit for osteoclast derived from the monocytes through its vascular supply. So, in the summary, what does it mean? That the follicle, the dental follicle, is the most important part which provides osteoclasts for the bone forming cells. Without these, the bone will not form. Other studies on bone remodeling have indicated that control may reside with the bone lining cells, the osteoblast. It is proposed that these cells, under hormonal influence, secrete collagenase and other proteolytic enzymes to remove the osteoid layer. In so doing, these cells round up and expose the newly denuded mineralized bone surface, providing the stimulus to attract osteoclasts to the site. Now, the root formation theory, that part, because the bone formation theory is up to date, but there are some studies that prohibited the theory. The evidence against them that it causes or effects are debatable. How does it happen, or how do you know that this is the reason? That's why there are some doubts about the bone remodeling theory, so it is not well refined. Root formation theory of eruption, evidence in support. If crown movement is prevented, bone resorption occurs at the base. See, what does it mean? That root formation propels the tooth upward and make it erupt in the oral cavity. That's the summary of the root formation theory. So, what does it say? That the crown movement is prohibited. The crown is prohibited to emerge in the oral cavity. Then what happens? The bone resorption occurs at the apex of the root. What does it show? That root formation is important for the eruption. Growth of root impinges on a fixed base cushion hammock ligament that translate apical force to the eruptive force. Now, what does it mean? That the growth of root makes a pressure that is the apical force that translates the apical force to the eruptive force with the help of fixed base cushion hammock ligament. Okay, now what are the evidence against it? What are the disadvantages of this? Cushion hammock ligament is a membrane and has no bony insertion, so can't act as a fixed base to translate apical force to the occlusal force. Eruptive distance are greater than the length of the root. So this theory is discarded. Rootless teeth also erupt rarely. Vascular pressure theory. It increases It says that increase in apical hydrostatic pressure by hypotensive drugs increases eruption rate. We give the patient hypertensive drugs or use the hypertensive drugs which increases the apical hydrostatic pressure in the apical region of the root, and this creates a pressure which erupts the tooth or increases the eruption rate. The sympathetic nerve stimulation causes vasoconstriction, thereby decreasing the apical hydrostatic pressure. Eruption rate decreases. So this theory says that vascular pressure is very important for the eruption. If there is no vascular pressure, no eruption will occur. But what are the disadvantages of this theory? Experimental root resection and insertion of a metallic barrier to cut off apical hydrostatic pressure. There is no change in the eruption rate. So this theory was also discarded because after insertion of a metallic barrier to prohibit it, to prohibit the pressure, vascular pressure, but there is no change in the eruption rate. The eruption rate is normal and the tooth is erupting in the oral cavity. Injection of lignocaine with or without what vasoconstrictor adrenaline to cause decreased hydrostatic pressure results in an increased rate of eruption. So this theory was very much discarded. Periodontal ligament traction theory, experimental root resection and metallic barrier insertion, distal fragment erupt due to attachment of dental follicles. So it used the bone remodeling theory as a base, or it has a ideality to the bone remodeling theory. Took at an example and done an experimental root resection and put a metallic barrier insertion in the apex of the root, okay, to cut off the hydrostatic pressure. So what will happen? The distal fragment erupt due to attachment of the dental follicle. Because the dental follicle is attached, it erupts in the oral cavity. Diseases affecting dental follicle, delay eruption. So dental follicle is very important. Drugs interfering with collagen fiber formation, delay eruption. So collagen fibers in the dental follicles are very important to note. Tissue culture experiment, fibroblast of dental follicle contracts collagen gel contractile force. Summation leads to eruptive force. So what does it mean? That fibroblast in the dental follicles contracts the collagen gel, which produces a contractile force that helps in the eruption of the tooth. Now, what is the difference between the periodontal ligament traction theory and the bone remodeling theory? In the bone remodeling theory, what does it say? The dental follicle is causing osteoblast and osteoclast to do something about the eruption. But here, the dental follicles is itself causing something to erupt the tooth. It is making the contractile force for the summation leads to eruption. Okay. Now the evidence against periodontal ligament fibroblasts are not attached to the bone or not properly oriented for the eruption in the pre-eruptive phase, but in the post-eruptive phase they are attached. The existence of fibronexus and contractility of fibroblast are disputed. So the existence of fibronexus and the contractility of fibroblast is not considered very well in this. Okay, that's why all the theories have some disadvantages or demerits, but they also have some merits. Mainly the bone remodeling and the periodontal ligament traction theory are the important ones. Now, what's the clinical consideration? Variation in schedule time of eruption. What does it mean? That generally there is a remarkable consistency of the eruption schedule of the human dentition that reflects a programmed eruption process. But sometimes there is a variation. Sometimes it delays, sometimes it's premature eruption, or it can be a nettle teeth. It means those teeth, the mandible central incisor that are already present in the oral cavity of infants at the time of birth. That's what it is. Premature eruption, or it occurs infrequently and may occasionally be seen in a permanent tooth that has prematurely lost its deciduous precursors. Means the permanent tooth has already occurred in a premature condition. Delayed or retarded eruption means that the permanent tooth is erupting in the oral cavity, but the deciduous teeth is not shedding, or there is a delay in the eruption of the teeth. Orthodontic tooth movement, the principal supporting tissue of the tooth, the periodontal ligament, and the bones of the jaw possesses a remarkable plasticity that enables the tooth to react favorably or unfavorably to its immediate environment. So what does it mean? That the formation of the bone of the jaw causes the development of the jaw to the frontal side, or it can be stagnant, so it reduces to its shorter side. This causes the shortening causes crowding in the tooth, while the elongation of the bone and there is no orthodontic tooth movement in the tooth or the eruption of the tooth. This causes the class 2 in the patient. Class 2 means there is widens gap between the tooth, okay, between the different types of teeth. Impaction of teeth because of the physiological mesial shift. There are impactions of teeth. You have always heard of the impaction of third molar, the wisdom tooth. So it's very important. Primary failure of eruption. There are sometimes failure of eruption. There is no eruption. It is a condition where permanent teeth, especially molars, so it is common in molars, to erupt. The failure of eruption has no identifiable systemic or local causes and shows no difference in incidence between maxillary and mandibular teeth or between sexes. So there is no predilection about in which age does it occur, in which sex does it occur, male or female or another, or the teeth. It's just that infection can, the primary failure of eruption can occur in any teeth and in any individual. Hypereruption of teeth. This is a condition where the loss of an opposing tooth has caused the teeth to erupt to a greater than normal distance. It means that if you have the maxillary first molar but do not have the mandibular first molar, the maxillary first molar will emerge more in the oral cavity because there is no opposing force against it. So it will emerge greater in the oral cavity and causes dysfunctioning. Teething, it means the breaking out of tooth through the oral epithelium is often associated with an acute inflammatory response to the connective tissue adjacent to the erupting tooth. The child will manifest symptoms of inflammation such as pain, mild fever, general malaise, which are popularly called teething. So, whenever you see a baby, it wants to chew something. Whenever there is the eruption period occurring, he wants to chew something. That's because the teething causes an inflammation in the gums or the connecting phase, connecting tissues. So he wants to chew something to negate the effect of inflammation and helps that teeth to erupt in the oral cavity faster. Thank you so much. I hope you found this video useful. If you want the PPT, follow the link below. And if you have any doubts or queries about this video, please comment down below or message us on Instagram page. We'll try to solve it as soon as possible. And please like, comment, and share this video as much as possible. Thank you so much.